Wonderful. Well, it's a minute past the hour, so we'll go ahead and get started while people continue to join. So it's my great pleasure to welcome you to today's webinar. My name is Emmy Betts. I'm an associate professor of emergency medicine at the University of Colorado Anschutz Medical Campus. And I also serve as the deputy director for the Injury and Violence Prevention Center based at the Colorado School of Public Health in the School of Medicine. Today, we are thrilled to be co-hosting a webinar with the Centers for American Indian and Alaska Native Health entitled First Steps, a Lockbox Pilot Program Focused on Opioid Abuse Prevention in a Tribal Community. Today's presentation will talk about the steps involved with the launching of a pilot program to research prevention effectiveness for the distribution and monitoring of lockboxes for clients with opioid medication in a tribal community. Before I introduce our speakers, a couple of housekeeping notes. First, we will have time for a Q&A session at the end, so please put your questions into the Q&A box. You can also put them in the chat box, but I've let the speakers know that they can wait to answer until the end. The session is going to be recorded and we will post it on our website afterwards. And we are thrilled actually that we're packing it in this holiday season. Our next webinar will actually be next week, Tuesday, December 15th at noon, focusing on occupational injuries among firefighters, a timely topic given all the recent wildfires. And our guest speakers will be Dr. Thomas Hales and Dr. Alyssa Koval. So it is now my great pleasure to introduce our speakers today, and we really appreciate them taking the time to teach us and for us to be able to talk with them. First, Commander Robert Morones is currently the Area Injury Prevention Program Manager for the Phoenix Area Indian Health Service. In that role, he is responsible for managing the Phoenix Area Injury Prevention Program, focusing on assisting over 40 Arizona, California, Nevada, and Utah tribes and Indian Health Service staff in the development of community-based injury prevention programs and initiatives. Next, we'll hear from Monty Yazzie, who is the Injury Prevention Program Coordinator for the Salt River Pima Maricopa Indian Community, where he's working to increase the health status and decrease unintentional injuries within that community. He is also a child passenger safety instructor, a yoga and Tai Chi instructor, and he provides partnership and collaboration interventions as one of the leads for community health and wellness, the Community Health and Wellness Summit Committee. And last but not least, we have Dr. Nancy Mangieri. She is the community epidemiologist at the Salt River Pima Maricopa Indian Community in Scottsdale, Arizona. Working within this community, she focuses on all things public health, with a special emphasis on infectious communicable diseases and sexually transmitted infections. Not surprisingly, her days since early 2020 have been focused on COVID-19 monitoring, surveillance, prevention, and data collection, but we are thrilled to have her with us today to talk about her role on this project. And with that, I'm going to turn it over to Commander Morones. Thank you.
Oh, while Monty's getting that set up, I want to thank everybody for having me. So again, I'm Rob Morones. I'm the Injury Prevention Program Manager for the Phoenix Area Indian Health Service. So I'm excited to be here talking to you all, especially, amongst this pandemic. I know the COVID pandemic has sort of everyone's attention now, but I think we truly believe that the opioid crisis is still sort of one of the underlying issues that we're facing. It hasn't gone away. It's certainly still kind of paving its way. So next slide, Monty, please. So for our service area, as many of you know, the Indian Health Service is broken down into 12 service areas or regions. I'm responsible for the Phoenix area, which provides services to 45 tribes in 4 states, which are Nevada, Arizona, Utah, and parts of California. For us, our injury prevention program, we're fortunate enough to have 4 dedicated staff. They're full-time injury prevention practitioners, challenged with the issue of injury in Native American communities that we serve. So our program is housed really under the Division of Environmental Health Services in the Indian Health Service, which is sort of like the tribe or Indian Health Services public health department. And under there,
Sorry to jump in very briefly.
Sure.
Monty, could you please put it in presentation mode? Because we're still seeing only the first slide.
Got it.
Oh.
Sorry to interrupt you, Commander.
Slide 3. No worries.
Oh, thank you.
Appreciate it. Next slide, Monty.
If you go up under slideshow, that should help you get into from current slide actually will work. There you go.
There you go. We're on slide 3.
Are you guys seeing that okay?
It looks like it's thinking.
It is doing some thinking. Yeah, I think we're
On my side, I'm on slide 3.
You might need to try to unshare and then try sharing again, and then we might be set. Oh.
Half of America is online right now, bogging down the internet.
And all the kids, so.
Including my son in the next room over. We all set? There we go. Wait.
So now we can see, so try display settings up at the top. Oh, unclick the presenter, use presenter view, and then it should work. There you go. Now try for current slide, and then we're good.
Fantastic. Thank you, Monty. Thank you, everyone. So I think where I was talking about how our program is housed within the Division of Environmental Health Services, which is the public health structure. We have 16 field-based, what we'll call environmental health officers out there doing public health work, and they're really the backbone of our program. We essentially help them work with the tribes to identify, injury trends and patterns, and help develop interventions. So our program, in injury prevention program, obviously our challenge is to address some of the risk factors that our Native American communities face. And you might imagine motor vehicle crashes is a big one. Falls is another big one, assaults and whatnot. Many people don't realize that poisonings are actually what we categorize as an injury, a chemical injury. So we work to help our clinics address some of the poison injuries, including opioids that we've been facing recently. Next slide, Monty. So a little bit about the problem that we've been facing. This data goes back to 2016. Opioids are killing Americans, over 100 each day. And the economic burden of that is $78.5 billion a year and climbing, just to address this issue of opioids. Out here in Arizona, we saw a 74% increase in 2012, which certainly set off the alarms. In 2016, we had over 1,500 drug overdoses in Arizona alone, and over half of those were really related to some sort of opioid. Our Native American communities are certainly, not immune to this issue. The opioid-related deaths and hospitalizations and ED visits increased 310% between 2008 and 2016, which was really, our call to action. We saw 235 cases in 2008, and then in 2016, the data suggested around 965 cases. Usually poisonings aren't that high. They shake out maybe the 4th or 5th leading cause, and in 2016, they're actually rivaling motor vehicle crashes, which has been the leading cause since we started our surveillance. Next slide, Monty. So for our program, we understood that the clinics were already facing this issue of trying to control the prescriptions of opioids and opioid substances. So we tried to figure out what we could do. And most of our activities happen in the communities. We partner with community programs and services and individuals to try to make some sort of change in the knowledge and attitudes and behaviors in the community. And some of the things that we do is we raise awareness, obviously using data. We conduct surveillance so we can highlight the problems to the tribes and back to the clinics if they don't already know. But then one of the big things our program does is we connect tribes to resources that they may not have or they may not be aware of. So some of the resources that we connected the tribes with were naloxone, which reverses the effects of some of the opioids. Medication-assisted treatment. We try to connect tribes and behavioral health programs to training so they can provide this treatment in their communities. And then medication disposal options. We understand that in many tribal communities, they're stockpiling of medications in the homes for a variety of reasons. And one of them is they simply just don't have a good understanding of how to dispose of them other than throwing them in the trash or flushing them down the toilet. So we launched two different programs. One is the disposal pouches, where they can drop their medications in a bag, add water, shake it up, and throw it away with the domestic trash safely. And then the other was the installation of medication drop boxes, similar to a mailbox. If they have excess or unused medications, they can drop them in there with no questions asked. And those have shown some real promise. The other one, the last one, and what we're here to talk about today, is safeguarding medications within the home. We do a lot of work within the homes, whether it's fall prevention, fire prevention, whatnot. One of the common things we see is the stockpile of medications. And a lot of times, anecdotally, elders will tell us that they have issues sometimes with medication theft or diversion, or grandchildren that they look after trying to get in to some of the medications that they might have laying around that aren't locked up. So we put our heads together and tried to figure out a way that where we could help folks in the home environment lock these medications up safely, so only they have access or their caregivers have access. Next slide, Monty. So we designed this medication lockbox project really with tribal input. We conducted 10 focus groups in 9 tribal communities. I think we had 102 participants. We also held key informed interviews with program managers and key stakeholders in those communities to try to get through the barriers up front so we could launch this program. Some of the inclusion factors that we used for the project were, the age had to be 50 or higher, which is a common age that tribes use for their services. They had to be a tribal resident. They had to be prescribed at least one chronic pain medication. And then they had to agree to follow-up visits from our team to check up on the use of the box. So we installed 55 boxes in 9 participating communities. Those were in Nevada and Arizona. We used a community-based approach, a team approach comprised of PHNs, CHRs, tribal health departments, health ed, senior centers, IHS, and many others. And we found that to be really helpful because each member or piece of that team brought their own view of how things would work. And in each community, believe it or not, worked just a little bit differently. So we had to stay flexible when we did this. Next slide, Monty.
So I'm going to take over for just a little bit. This is Monty Ozzie with the Salt River Pima Maricopa Indian Community. So as Commander Morones was explaining, they developed this lockbox program, and we're introducing it to tribal communities. My job on a daily basis in Salt River focuses more on fall prevention, transportation safety, traumatic brain injury, and vehicle education as well too. So when Commander Morones approached Salt River and talked about this idea of introducing a lockbox, it came at really a perfect time because in Salt River, we were facing some tremendous obstacles in terms of the opioid abuse that was happening here. And right about the same time, Commander was introducing a lockbox program. We had a call to action by our tribal council here in Salt River that specifically was calling for a commitment to campaign a battle, or to commit to a campaign to battle the increasing trend of illegal drug distribution, illegal drug use, and the resulting deaths by alcohol and illegal drug use occurring in the Salt River Pima Maricopa Indian community. And that's directly from their call to action. And that call to action from Tribal Council went out to all programs within Salt River, really focusing on programs to find ways to create interventions and to find programs and evidence-based strategies to help with the opioid crisis in the community. So the pilot program came to us at a really great time, and it was an opportunity for us to really work with our partnerships within the community, really work with other programs to find inventive ways to combat the opioid crisis in Salt River. So Commander had introduced this idea of bringing in lockboxes and told us that we could have quite a few lockboxes, 10 to be exact, for our community distribution, and creating this pilot program where we would find folks in the community who might use this lockbox effectively. So we focus on a population of older adults who had voiced concerns about safeguarding opioids in the community. We wanted to make a manageable program built on evidence-based strategies and guidelines, and based on what was happening and what Commander had introduced concerning the lockbox, we found this to be a very effective strategy to utilize in the community, and one that in terms of complexities was actually very simplistic in terms of how we were going to target a intervention for the community. So one of the first things that we did with the community was start to look at our partnerships and start to look around in the community for who we could use to install, to get these lockboxes out to the right clients and get them into their homes. So one of the first things we did was start a working group. Our working group in the community consisted of the Indian Health Service partners that we had, our public health nursing team, our environmental health staff, and our police and fire departments, as well as our community development programs here in the community. All these programs are working with clients who may come in contact with opioids or are working in homes that these clients may be residing in. So we found this working group to be extremely effective in just bringing everybody to the table to get an understanding of how we might move forward with this lockbox program. Within that discussion, we started to understand how we were going to choose participants for this idea. And it was our public health nursing team and the Salt River Pharmacy who had come up with kind of a criteria for how we were going to choose our participants. Based on previous home visits, high-risk clients with opioid medication prescriptions, clients who have reported lost or stolen medication, and clients who had safety concerns regarding access to medication, was the criteria that we were looking at in terms of how we were going to select the clients that we were going to introduce this lockbox program to. After that, our working group had to decide how we were going to install these and how we were going to get the team together and how we were going to bring them all together. So our next steps in focusing on the lockbox program was understanding a participant selection criteria. And Commander had explained earlier that they kind of had an idea as to how they wanted to introduce these lockboxes into the community. So we targeted on 3 things: 50 years of age and older, they had to be tribal residents, and they had to be prescribed chronic medication. We had a lockbox candidate meeting. So our public health nursing team had selected 10 folks to come in to get an understanding of how this lockbox program was going to work. This candidate meeting was really an opportunity for them to see and feel the lockbox and understand, like, you know, how we were going to install these and how we were going to put them in their homes and how they were going to use them, and really get an understanding as to how they were going to work. And as you see in the pictures on the side here, the lockboxes have a keypad as well as a key entry as well too. So they have the number pad that you can put a password in, as well as a backup key that you can utilize to unlock the safe if the dial-in code doesn't work. And we really wanted to take an opportunity to have every client have an opportunity to see the box, to see how it works, and really just kind of take the opportunity to understand their concerns about using the box. It was actually a really great meeting because, you know, we're trying to work with this community, and there's all these new faces that are coming in, and having that opportunity to have the public health nursing team introduce us to these clients who they had been seeing for many years, and for many of whom had already developed a vessel of trust with the clients, was very helpful in getting people to understand that, you know, all we're going to do is install this lockbox in your home, and we hope that you use it effectively to store your opioid medication. We did feedback surveys, basically asking questions: where would you like it installed? What do you plan on putting in the lockbox? And then we would have them show us how they would use it, show them how to put in the passcode and how to open it with the key and all those different obstacles that they might encounter. So after we developed the working group, after we had our participation meeting with our clients, then we had to create an install path. And we were lucky that we were able to do this in a week's time. 10 boxes doesn't seem like a whole lot, but working on people's time and getting people to schedule appointments, we were able to do all 10 boxes in 2 days. And our team of 5 community employees included 2 lockbox installers, who was myself and then someone else in environmental health, 2 community health nurses who were basically the liaisons for the clients who had already established the trust within the home. And then we had 1 Indian Health Service liaison who would come and help out as well. You'll see in the top right picture there's 2 people installing that little lockbox. Well, there's another person on the other side who's like holding the lockbox in place. And I don't think it takes 3 people to install the lockbox, but our first few lockboxes was trial and error. But we ended up getting them installed really effectively and found very, very simplistic ways to get them installed and keep them secure. Our install procedure when we came to the homes of our clients was the community health nursing team took the lead with the client before the installers even entered the home. So the community health nursing team would go in, they talk with the clients, they give them the initial paperwork, they discuss where they would want the lockbox installed, and then the installers would come in and work with the client and work with the designated spot that they had chosen in their home. After the install, Injury Prevention and Salt River Police Department took ownership of extra lockbox keys. And this was for emergency purposes in case the batteries died in the dial pad, or in case they forgot the password to their safe, or if some emergency happened where we needed to get into their lockbox to access the materials inside. Injury Prevention and Salt River Police Department established basically a hotline that the folks could call so that we can come and bring a key to them and open their lockboxes. And once again, 10 community homes received lockboxes. Our evaluation process consisted of an initial survey that we gave to every single person that was in the lockbox pilot test. We had a 30-day survey, a 60-day survey, and then we had our final outcomes. Our 30-day and 60-day evaluations were done by the public health nursing team as they would go back for home visits with many of these clients. They were the ones who were in charge of doing the 30 and 60-day surveys with the clients. And that will be my transition to Dr. Mangieri, who was one of the key personnel in conducting these surveys for the homes.
Thank you, Monty. Thank you, Commander. This was a wonderful project. The public health nurses could not wait to get involved in this faster. We had a problem in the homes with the storage of medication, opioids, as well as other medications. And we never really had a good practical solution. And when this project came along, we leapt forward to be partners with this, with Indian Health Service and with Monty and Injury Prevention. We felt that this was a very actionable project. We felt that we could take the concept of safety and harm reduction, and we could actually put something practical into place. So although we were focused on opioids, this box really assisted people across the board. It gave them an idea and a concept to have a respect for the dangerous medications that they may have had in their home, but it also gave them an opportunity to store safely, as the commander said, in homes where there are multi-generational people, children, grandparents taking care of children. And we also at this time had an opportunity to work with the pharmacies to begin to understand the volume of medications that people were storing in their homes. This is by no means a small problem, and this was a very practical and simple solution. Monty made it sound like it was very easy for the installers, but I do have to say that one thing that this was a team building event for the people in Salt River. It gave us an opportunity to work with a variety of different programs. to be able to come up with a really practical solution to a very difficult problem. As a public health nurse, being in homes for years with these people, I had never really heard them talk about theft. I had never really heard them talk about danger, where family members or friends of family members were coming into the home and taking their medications. So it really gave us an opportunity to look into the window of storage of medications in a safe way. And so we were really, really excited about this project. Next slide, Monty. So Monty talked about the evaluations, and I think it's really important for us to understand that whenever we do a project, it's really important to look at where we started and where we ended up, and in between, how successful were we? Well, this one's really hard to believe, but it's true. This was a 100% successful program. This changed the home environment of the 10 people who had these boxes installed. They took ownership of these boxes. These boxes belonged to them. They weren't being lent from the Indian Health Service. They weren't the property of Salt River. They became the property of these clients immediately, and they were encouraged to use them. And we did have an incredible compliance, 100% compliance of using these, but the front end work of meeting with them, gaining their trust, as Monty said, letting them touch them, feel them, look at them. All of this really empowered these people to feel that these boxes were a solution to a problem that they had inside their home. And that is why I believe we had that 100% compliance. So the 60-day evaluation gave us insight into the fact that they had embraced this idea, and public health nurses were in those homes much more than on 30 days and 60 days. We were there a week later, 2 weeks later, and we were watching these people take on the responsibility of storing their medications safely. Next slide, Monty. So here is an example. That looks like a lot of medication, and it actually is. But one of the things that public health nurses have been working toward is giving clients the responsibility of housing their medications in their homes, so that when we came to help them put them into their med boxes and things like that, that they were able to go over to their into their lockbox, open up this lockbox, get their medications out, have a participation piece in managing their medications. And they could do that safely with these lockboxes. Did they store other things in the lockboxes? They did. And that was a good thing. We had weapons that were being stored in these lockboxes. Was that their intention? No. Was that a benefit, an added benefit to this? It was, because in some cases, these weapons were being stored safely for the very first time within a home, right next to their medications. So these lockboxes ended up having a far broader safety impact than just housing opioids. But they did, in some cases, house valuables, and in some cases, weapons. So 100% during the 60 days that we were evaluating this project, we have a long list of people who wish to participate. Word in a community like Salt River, word gets out very quickly of something that works well and that enhances the person's life. And so seniors are talking to seniors. My lockbox, I have a lockbox. And of course, we were getting phone calls asking, can I get on the lockbox list? And so here we went from a project where there was some reluctance in the beginning. There was like, what is this about? Who do we trust? To people really wanting to participate. And the conversation about safely storing medications was out in the open, very much so. And people started to want to participate. So I think that that is an important piece to know, that this lockbox project has longer arms and bigger impact than just opioids. Next slide, Monty. So were there barriers? Of course there were barriers. There's always barriers. But I do have to tell you that these barriers were very easy to get around. once we realized how important this project was going to be. Installation concerns, yes. Not everybody wants to drill holes in somebody else's house. And so we had a little bit of reluctance with that, but Monty and his team did a great job of getting these lock boxes installed. And if you noticed in the pictures, the installation got neater and neater because Monty had 2 public health nurses squawking at him that they didn't want the wood to stick out the sides because it looked ugly. And Monty figured out how to make it look as sleek and as professional as you're looking at right now. These things were assets to these homes. And as you can see, a lovely installation. Establishing proper connections. This was really important as well. It was the very first time that public health nursing and the pharmacy had ever really sat down and discussed who's got the most medications here in Salt River. And then, of course, the ever proverbial why. Why do they have so many medications? But the point was we were able to sort through a community and see who had the most need. One thing I do want to mention also is although the criteria that the commander and Monty mentioned is what we followed, we did have the flexibility, thank you to the commander, to be able to include a couple people who didn't meet that criteria. And these were people living independently with serious mental illness. So these were people who live alone. They're not 50 yet, but they do have some challenges and some serious medications that they take for their mental health and also for seizures as well. So we had an opportunity to be able to work with that team as well. So this doesn't just apply to people getting opioids. It applies to looking at the population and how do we store medications safely. Funding, well, they were free, which was great. And we really appreciate that. And because this was such an important project to the community members telling tribal leadership how much of a difference this made in their home, how much safer their grandchildren were, how much they weren't having things stolen from them. The tribal community was very anxious to expand this program. So right there, a barrier became an asset. So that was really an important part. And our successes continue to this day. Our successes continue because the community engagement continues. The partnerships have been enriched with us all working together to come up with an actionable, simple solution to a very difficult problem. We know for a fact that we've had families who have no longer experienced theft of medication. We're able to open these lock boxes and get rid of expired medications because they're all in one place versus all over the house. And so we're able to look at them and get rid of them in an efficient and effective way. And for me, as the epidemiologist, the data collection is amazing. It's rich. It gives us the opportunity to be able to look at a project that we started, gather the data, and give us an idea of what we need to do in the community to make this successful. And this lockbox project was the answer to housing medications safely within these homes in an inexpensive way that is very much a project that can be executed in any community because there's really no special skills involved in doing this. So Monty, I believe that's it for me, but I just wanted to say that the success of this is still going on today. So thank you.
After our lockbox program had finished, the pilot had finished, we were invited about midway through, I take that back, about midway through our lockbox program, we were invited by tribal council to give an update about how everything was going. And we gave a similar, much more abbreviated version of what you guys have just seen today to our tribal council, who were extremely happy with what was going on. And as Nancy had mentioned, building this program and the successes of partnerships and engagement with other departments have been monumental in terms of steering us towards a future where we can protect opioids in the homes of clients that need it. And, you know, our goal for this program was always to create this safe and secure way to lock up opioid medication and make sure that those medications remain in the right hands and provide those safe and responsible measures to people so that they can prevent the abuse of the opioids that may be in their control. And our hope, looking into the future and expanding greater and utilizing our partnerships to build this program into something where we would like every client that needs a lockbox, provide every client in the community with the means to have a lockbox in their home, is that this intervention will offer community members that ability to be safe, to have that trust where they can, that trust and ownership of a lockbox to make sure that everything is safe. And our hope is that we can save a life or prevent an injury. And in doing so, even if it's just one life that we save, all of the work that we have put into it has been worth it. And we're so happy and fortunate to have the support that we have now, as well as have the amazing partnerships and the ability to move forward with this project in the future. And I am extremely hopeful for what happens with this project moving forward, and hopefully coming back in 5 years to have even greater results to talk about what we've done, and in 10 years to talk about those great successes, and moving farther even into the future to show that this very effective program can really promote some monumental change. Folks, if you have any questions, I know I'm going to turn it back over to our moderators, but thank you again so much for the opportunity to be able to present to you today. We love what we do in the community, and I love working with the two people that got to present today. And I thank them very much for their time and their dedication to the program in Salt River. They are phenomenal partners, and I cannot speak their praises loud enough.
Well, thank you so much for the presentation, and just congratulations on a phenomenal program addressing a really important, an important issue, certainly in most communities, not just yours, but also I think your presentation really highlighted that critical piece of community engagement and collaboration from the very beginning. And so we have questions flooding in, so I'm going to jump right into it. Monty, you were just talking a little bit about your hopes for the future, and I was wondering if you or others could elaborate a bit on sort of what things look like for either expanding to other sites or for long-term sustainability of the program. Especially, I know it sounds like the first boxes were donated, so kind of what does that piece look like going forward?
Our hope is that we can work with some opportunities to gain some funding, whether that's grant or through tribal designations of funds, to get more boxes so that we can reincorporate it back into the community. Since the program ended, we have been inundated with requests from other programs of people who have said, we heard about the lock boxes. I have clients who are interested. So it is definitely the word in the community right now that, this program will be launching perhaps greater in 2021, where we would be able to promote this program widespread. But we are looking into funding sources to see if we can get those boxes incorporated. And I am very confident that with the results and the data that we have shown on this pilot project, that finding that funding won't be very difficult in terms of finding what we need for our community here in Salt River. Nancy, did you want to expand on that a little bit more? I know that you have a lot of discussions with folks about this as well.
Thanks, Monty. Yes, this is a very affordable program. We actually started scanning through Amazon to find these exact boxes. We were able to locate them for a very modest price compared to what you might imagine. And the public health nursing budget had a little bit of play in it for some projects. There was some funding in other programs, such as the diabetes program. So the diabetes program had a little extra money left over that they wanted to be able to utilize. They had plenty of people in the program that have lots of medications due to diabetes. So these were initially made for opioids, but a lot of other programs, as Monty said, social workers started calling us. I have a client who has small children in the house. They have a very curious 2-year-old who's gotten into the medications several times. luckily never swallowed any, but they actually saw that threat. And so here we had staff starting to think about safety with medication within the home. I think the other thing that started to happen is schools started to get involved. So we had people at the schools talking about families where there were large numbers of children in the home, and curious children. And could we get a lockbox in those homes as well? And I think one of the things that we didn't talk about, but that is really important, is the children watching medications being safely stored, showing children how to be respectful of the fact that these are dangerous items that they should not be playing with, that need to be locked up. And so all of these examples of adults in the household exhibiting responsible behavior definitely rubs off on the children, and children asking questions in school about medications and lock boxes. And so it really has a fantastic ripple effect. And I believe, Monty, and Commander, you could tell me, these were under $50 a piece, correct? These lock boxes?
Yes, that's correct. You know, when we did our original search, we found them right around between $45 and $60 a piece, but I think ours came in at under $50, so which is pretty affordable, pretty reasonable.
Yeah, especially for a long-term solution.
Right.
And we did have a couple of one door, actually, just one door. A very eager police officer looking to help a client one evening around 2 a.m. Did choose to tear the door off versus use the key. But you know, these things happen, and we were able to replace that because the keys that Monty showed you are the keys that go with the police department, so that the community had 24/7 accessibility. That particular police officer wanted to help, but forgot about the keys. And the door didn't come off easily, I'll tell you that. Nor did the box come off the wall.
Yeah.
On that note, I think there are a couple questions about the devices themselves, and regarding the installation, which it sounds like was done by the public health nurses were trained to do it. Is that right? Or was it a handyman?
No, it was a Monty man.
It was a Monty man. Okay. Sort of in balancing, you know, that something that is secured to the wall certainly can't be stolen as easily, but also, you know, potentially could raise some challenges in terms of either cost, but also just the installation, or if people don't want it installed in their house. Did you look at or find alternative devices like not portable lock boxes that weren't installed on the wall, or did you consider any other kind of options?
Yeah, I know that Commander had mentioned smaller boxes, right? Smaller pill boxes that you wanted to do for a little bit.
Correct. You know, and really these boxes were identified and picked out by the focus group audience. You know, we had over 100 folks, and when we conducted the focus group, we actually purchased samples and models of a bunch of different types of boxes, and this was the model that they, you know, overwhelmingly chose, and really they chose it for the security part. It was heavy duty, and they liked the where it could be mounted to the wall. I think I saw a question in there from Gina about alternatives such as locking bags. We looked at locking bags. We presented them to the focus group participants, and they said, well, if we put all our medications in there to something that's not tethered or mounted, then everything goes if they want to get into it later. You know, we looked at those banker's bags, they're kind of really tough mesh, non-ripping style with the lock on, which were great if they weren't, you know, if the whole thing wasn't removed from the house. So that's kind of how we landed on these boxes. It was, you know, we just listened, you know, how focus groups operated. We let the community guide the discussion, and they narrowed down to that model, which was really, really fun to see. So
that's
yeah,
wonderful.
and you know, in terms of the install of the boxes, it was you know, the first few boxes, as Nancy had mentioned, were trial and error, trying to figure out how we were going to do them. We went with a really complicated route the first time, and it got more simplistic as we went along. So by the time we got our final 5 boxes installed, we were rolling in terms of identifying where the good support structures were in the home, what kind of materials we would need to drill into the walls. That also came with some guidance from our community development program, who were unfortunately not able to help us with this project, but had given some insight into how and where we would want to install in the homes. So.
Okay. There was one other specific question around the lockbox. Do you happen to know whether a certain number of times you could try the pin before you had to use the key?
There was no lockout mode on the boxes, so you could just enter them it would just keep letting you enter until you got the right code.
Okay.
And I know there were a couple times where I got phone calls from police officers who had asked me if I had known the password, and that's usually when we referred them to the key. And at that point in time, I would contact Nancy or our other public health nurse to go back and reestablish another PIN for them at that time. So.
Wonderful. So there's a question, and I have to say the one that's near and dear to my own heart for suicide prevention from firearms. And I know from the photo, it certainly looks like at least one handgun could fit in the boxes as well. And I think one of you mentioned that some people did end up storing weapons in it. So hoping maybe you could just comment a little bit on whether firearm storage or firearm suicide, using the boxes for that, came up in focus groups or in kind of what people were doing. Was it part of the messaging? Sort of, do you think that the program might incorporate that in the future? Any thoughts you have on that piece?
Yeah. Oh, I'm sorry. Go ahead, Nancy.
No. You go ahead. Go ahead.
Oh, okay. Certainly during the focus groups, our intent was to try to identify some sort of mechanism to safeguard medications. But during the discussions, a lot of chatter about what other types of things they would store in there, whether it be firearms or paperwork or whatever. So we had an understanding going in that it might be used for that. And then certainly after, we had a chance to look at all of the data and all the notes taken during the follow-ups, we saw that was happening. And subsequently, we had 2 follow-on projects into tribal communities who are using them specifically for suicide prevention, restricting means to access projects. So that was fun to see. And I think Nancy had mentioned it when she was talking about it, that it's fabulous that, it gets multiple uses and people are kind of taking ownership and seeing what types of things that can be secured to reduce some of these risks in the homes.
Well, and also too, I think there's a dependence on the tribal community that you're working with, because some tribal communities have different laws in terms of what kind of weapons people can have in the communities. So that was in terms of meeting and talking with each client, we were very aware that there may be weapons stored in the lock boxes. We basically just took the approach of you're going to store what you want to keep safe in the box. And that's really how we left it. And we made it a point to focus it on opioid medication, but we also left the door open if they wanted to use it for other purposes as well too. I remember there were a couple boxes that would have important documents as well too inside there. People kept in birth certificates and things like that inside there. And jewelry. There was one that had jewelry inside it as well too.
Because are they fire safe? Those boxes looked pretty thick. Yeah.
They are fire safe. Yep.
Yeah. Nancy, did you have something to add to this question?
No, I just wanted to say that I think what the public health nurses appreciated the most actually was the flexibility that we had within this program to meet the need of the client in the home. What was it that related to a safety piece that we could use this box for? And so we really appreciated the opportunity to include people that were not in that 50 plus. We tried to get examples of groups of people throughout the community during this pilot group so that we could see. One of the other things about mounting these that was so successful was our people in wheelchairs. We were able to mount them at a height where they could reach these from their wheelchair. So we were able to actually work with them in their wheelchair, measure it out, and give them access. And most other solutions, that would not be the case. But by customizing the installation. And another part was helping people who have hoarding issues be able to find a place in their home where they could put some of their things safely and know where they could find them. Because as we know with hoarding, that becomes a big issue. And so the fact that the hoarders were allowing us to come into their home, which is a pretty secret place for them, to put something like this in there really gave the public health nurses an opportunity to engage clients that we would not have had before. So this project has so many arms to it. It really, really does. That we're finding it's like an onion. It just keeps evolving, all of the benefits and all of the things that that are coming out of this lockbox project.
Now, will you be doing additional follow-up with the group from this pilot?
Oh, we already are.
Okay. Yeah.
We already are. And in fact, sadly, one of our participants has passed. And so we were able to engage with the family to let them get access to the box, put in a new code, give them the information about the key, do the education piece. And, you know, just as a side note, they found some really wonderful things in that lockbox after that person passed that had been safely kept there. So there's, again, it's a real community project, a real interactive project.
It's so wonderful. And I think I heard you say the paper is accepted and coming out at some point in injury prevention. So we'll keep an eye out for that. Do you know, I don't know if you know when it's coming out.
Yeah, I think it's in top of the year, I believe, January. It might be in the British Medical Journal of Injury Prevention. So.
Wonderful, wonderful. Let's see, a couple other questions. So there's one about for the monitoring it. So was any part of this project around monitoring the actual medications and what people were taking or the numbers they were taking in terms of the actual pills?
That's monitored through our pharmacy. Our pharmacy has a project where only a specific amount of opioids can be dispensed to any patient at one time. And the public health nurses doing medication management out of those boxes. It was really a place to store the medication for the client in the home versus keeping it back in our medication room where they would not have access to it as readily if they needed it.
And then this probably relates back a little bit to what we were talking about before in next steps, but a specific question what other tribes are doing the project right now in the Phoenix area?
Sure. So, obviously with COVID, I think it may have, put a pause on a lot of these activities. But last I checked in January, we had 4 tribes in the Phoenix area that sort of taken it on their own, either wanted to extend the pilot project or weren't a part of the original project, but heard about it and wanted to replicate it in their own community. So, we've touched base a little bit since then, but we're hoping to get past this pandemic before we, get back and try to get back into the homes and help them out. So. But other REHS areas certainly have talked about it. I'm not sure, how far along they've gotten. So,
well, for last question, I would love to just ask each of you, besides an end to COVID and sort of the challenges it's brought for your program as well. What's your wish list if you for this project? What you would like? So maybe we'll start with Monty. If you could have anything, what would you want?
I would love to see this program get to a point where every new house that's being built in the community is set up with a lockbox, that it's established right as the home's being built, that there is an effective way to store things safely in a place in their home. And for me, if the future gets to a point where, where we have residents who have the capabilities to keep things safe, that would be the ultimate success for me in seeing for the future that we just have people who can take responsibility of it. So.
Wonderful. Nancy, how about you?
I would just really love to see each one of our community members reach their full health potential. And some of that is based around eliminating some of these risks and giving them every opportunity to be able to live long and healthy lives without the interruption of some of these issues that happen, as you mentioned, suicide, overdoses, things like that. So that would be my wish. My wish was, as Monty said, a box in every house and good health in every house as well.
Wonderful. And Commander Morones, you got to top that.
Well, yeah, right. Well, I think I should probably start. I saw Captain Holly Bailey's name on the participant list, and I should probably start by saying this was really kind of all, me selling this project to her and her providing the funding to do this. This was, she was able to identify some funds to do some special initiatives in the areas, and this was kind of, originated by her. But for me, I think, perhaps our next steps and some of the things we're thinking about doing in the Phoenix area is trying to incorporate pharmacy as perhaps the sentinel or the lead on this project, because they have control over what's being prescribed and who's at risk and potentially at risk, and them being able to identify the target audience, so to speak, and maybe even dispensing the box or connecting with community programs that can dispense the box, which will likely require somebody paying for it. So that's my immediate wish.
Well, wonderful. I wish I could make that all happen for you, but really congratulations on this phenomenal work. And thank you so much for your time today to share with us. Thank you to all the attendees who came today. We will be sending out a link with the recording for the webinar for people who missed it or you just want to watch it again. And please do join us for our next webinar on Tuesday about occupational safety and firefighters, including all of those who've been fighting wildfires over this past year. So thank you all, and please have a happy and safe holidays.
Thank you.
Thank you.
Thank you.